I'm seeing males and females, both for this treatment. I'm seeing young teenage girls that are, playing sports and their concern is about overactive sweating. And then I'm also seeing older, all that are going through perimenopausal sweating as well. So there's definitely all kinds of people that are definitely great candidates for this treatment. And as Monique was saying, we are the fourth largest provider that's on the West Coast. So we have done several treatments. It does help by working to reduce so I'll kind of gear it a little bit to, hang on, it says my internet connection's a little unstable. Are you able to hear me, Monique?
Yeah, I can hear you, and it just cuts out a couple times.
Okay.
So if it gets unstable, maybe we might have to not broadcast to Instagram. That would be the only thing, is if it keeps doing that, you could stop that feed. Okay.
Okay, perfect. You just let me know if it gets a little too choppy.
Will do.
Okay, perfect. So miraDry is a great treatment for a medical condition that they call hyperhidrosis, which is excessive sweating. A lot of patients, though, also are coming to me, I notice, that just want the benefit of not having to wear underarm deodorant. It also gives you a little bit of reduction in hair, too. So this treatment has 3 added benefits. It has, the reduction in the sweat, as well as a reduction in the odor. And then you're also getting the added benefit of having reduction in the hair follicle as well. It's not our go-to treatment, obviously, for removal would be more for the underarm area, but added benefit as well. The way that miraDry works, we use thermal energy to help to heat the treatment area, which is in the axilla area, which would be like your underarm. It safely helps to eliminate, like I said, the sweat and the odor glands. So there is 2 different type of glands that are sweat glands. There's an African gland, which is the one that we are going to be talking about, that is the miraDry focuses on. And that's the one that helps to, it's the one that we secrete when we're, going through anxiety or emotional stress and those kind of sweating situations. It's the one that is connected to a hair follicle. So it also causes the smell that we get as well. The other glands are located mostly on the palms of our feet and our hands. Those are glands that aren't targeted during this treatment. Those are ones that, we can do Botox or different things with that sweat in those areas too. Okay. So that being said, that's kind of how the miraDry treatment works. The day of treatment, I'll kind of walk you through of like what you can expect. Typically the day of treatment, what I have patients do is I have them arrive about 30 minutes before their procedure. We'll apply a little bit of top numbing cream to the underarm area that we're going to be treating, just for the discomfort itself and just prep the area. We'll let that set for about 30 minutes. And then we'll make sure that we cleanse the area very well before we apply a little temporary tattoo. The temporary tattoo is just a little grid to kind of look at the underarm area. We tailor all of our treatments, of course, to all of our patients. So it's hard to say exactly, what size would fit the best for you. So we would definitely do a proper consultation with the patient prior to doing the treatment itself. And then we would also apply a little bit of tumescent, which is a local anesthesia to the area, where we do a little bit of numbing to kind of help also kind of bring out the underarm anatomy for us. Because if you underarm, it has a little concave to it. So when we do the treatment, we want to kind of puff it out and be able to kind of get the best grab of the tissue. And that will help with the discomfort during the treatment as well. I know that once we get that tumescent in, a lot of patients feel nothing at all. The treatment rooms are very nice. We have Netflix. We kind of, can chat. We, kind of relax after we get that part done there as well. Depending on your grid size and how big the underarm treatment area, the treatment could last anywhere from up to 30 minutes for each underarm, 40 for each underarm area. Typically, patients feel pretty comfortable throughout the treatment, like I said, but they are welcome, to take ibuprofen afterwards. In fact, we'll give you a post-care kit that has all the instructions in it for you, just to kind of help prep you for what to expect over the next few days. So that would be kind of like your day of treatment. Like I said, most patients are seeing great results with just doing 2 treatments. If you do have a significant history for hydrosis itself, which is a medical condition of overactive sweating, excessive sweating, then you might be one that needs maybe anywhere from 2 to 3 treatments. And those treatments we can spread out is up to about 2 months, 60 days apart. So any questions over anything yet? I know I see a lot of like little things dinging in there.
Yeah. One person asked, how long does it take to notice results?
Great question. So immediately right after the treatment, you're going to be a little bit kind of in shock. Your underarm area is going to be a little bit tender. It's going to be puffy. Immediately your body is going to kind of go in and kind of stop producing the sweat right away. So if you look at the studies, they say immediately it starts to kind of work, but we've watched, with patients, and we see that their added benefits continue up to about 3 weeks. And then they kind of do this wax and wane where they start to kind of have the sweat glands kind of start to produce sweat again. And then usually by that 90-day mark, they'll notice the max results from that treatment, but initially start to see results as well.
Okay, and one more question from the audience. Will I still need deodorant or antiperspirant?
Great question.
Oh, I like your teacup.
All right. We got the quarantine. Thank you. So, great question. Myself, I always tell patients, anytime before the treatment, you want to make sure that you're using a clean razor as well as deodorant products for after your treatment there. So we'll have you prep the night before and just leave a little tiny stubble of hair. And then at that first week to 10 days, you shouldn't be using any deodorant, as well as if you shouldn't be shaving either. And then after that, you might just be doing it out of habit. I know a lot of patients use antiperspirant sprays just out of habit as well, but you definitely should be seeing a reduction in the sweat as well as the smell. So you should be, decrease use of deodorant and they deterring you from wearing it again.
Okay. And one person asked, what's the downtime? Is there really any downtime that they need to worry about, or no?
So patients that go back to work the next day, the most important part is just making sure that you keep that area nice and clean after the treatment. I know we all, try to do our best in the shower, but we also will provide you with a little medicated kind of cleanser, which will kind of help keep that bacteria down in that area as well. And then also we want to just make sure that we're not overly extending the area in the arms after. So usually I'll tell patients, just be careful with your cardio or any kind of extensive exercise up to about 3 to 5 days afterwards. And then you can kind of go back to your routine. But other than that, you can go back to you would want to ice that evening and just kind of do the ibuprofen as needed for discomfort.
Okay. Another question came in. Is this procedure safe for patients with darker skin types?
Great question. Yes. So I have practiced this on patients all the way up to a Fitzpatrick skin type, probably 5. And it's safe. We don't have to worry about hyperpigmentating or anything like that. I'm thinking this question might be probably that they're for hair removal, which with laser hair removal, that's something in that area that you would kind of, darker skin types always have that potential to hyperpigmentate after the treatment. So this is going to be actually targeting those apocrine glands connected to the hair follicle. So that's how you get the actual reduction in the hair versus targeting that chromophore that's going to be producing the hair follicle.
Yeah. I remember our miraDry rep, because I had the procedure. I was patient number 1. So I got to be the guinea pig. And I remember her saying it's a colorblind treatment. So really anybody could have it, which is really nice because depending on the person, sometimes, like you say, we have to turn them away for certain kinds of lasers, but not for this. So one other question came in. how is the treatment performed with miraDry? And I'm not sure, that's how it was typed out, so I'm not quite sure what she means by that, but
it might be, so kind of like how we talked about, like walking you through your day. So we'd make sure that like you would kind of shave that area. And then once we get you kind of numb in the underarm area, that's when we would actually use our miraDry device. And that device uses this suction to kind of go through each area on the template where we've placed like that temporary tattoo to kind of treat the working glands a steady heat to kind of make sure that we're reducing any of that heat or any of those sweat glands in that area. So it's the dry machine that actually works, if that's the right answer to the question.
and also I think that is, and I think, and I can tell everybody, if you go to our Instagram, which is our medical spa Instagram, which is LJ Cosmetic Med Spa, that has, if you look at our story highlights, you can scroll and there's one called miraDry, and it does show us doing a procedure. And I'll also, I think we have some video from a year or so ago that when we did it, we did a Facebook Live where we have some video of the actual procedure. So I'll post that later because that might help people to be able to envision what it looks like.
Yeah, it's kind of hard to think through. And the temporary tattoo, I think, sounds kind of rather scary too. You're like, I'm going to get a tattoo, but it's really just a sticker that we kind of wet with alcohol, and it just kind of, you'll leave with no tattoo. So it's literally a quick and easy process.
So another question came in. It says, do I need to take medication during the treatment, and can I drive myself home?
Great question. So most patients are able to drive themselves home after the treatment. In fact, I don't think I've treated one patient yet that has had any need for like any higher dose medication. If you do have kind of like,
Oh, I think you cut out for those of us on Zoom. I think we're paused. Kara. I don't know if you guys are like me, you're everybody in the audience. I think we need to hope Kara can like come back in. Maybe somebody can text her. Uh-oh. Let me see. I think, I'll share my little thanks for attending, but well, we don't want to make like it's over, but I'm just thinking if I share my screen until she dials back in, then we can, she can keep answering questions. I know I can tell you from my own experience with what it feels like during the procedure. It really doesn't feel like anything. You can feel the suction of as they move around your armpit, you can kind of feel the machine pull your armpit in, like some suction. And it, has like a 20-second timer or something for each area. So it goes in, it sort of is basically destroying the sweat and odor gland. And then it has like 6 seconds of cooling off. And then she moves the thing to the next area. And so it just very methodically goes through the whole grid of your armpit, and then they move to the other armpit. So it doesn't really take that long, about an hour at the most. But sometimes less than that. You're totally numb for the procedure. So they actually do, like she talked about, the injections under the armpit with a local anesthetic. And so if you're sensitive to local anesthetic, I think that's one of the only contraindications, so that, you might not be able to have this procedure if you had a sensitivity. That's what I'm remembering. And then after the procedure itself, so they go through systematically both armpits, and then you have your little take-home kit, you have some ice packs, and what I recommend is just using those ice packs. Get like 4. So have 2 under your armpits and the other 2 in the freezer. And after 20 minutes, you can switch them back and forth, making sure that you don't have the ice directly on your armpit, because you're going to be numb for a couple hours after the procedure. And so because you're numb, it's just like kind of like with the dentist, you don't want to, like if you bite your tongue and you can't feel yourself biting it, you don't want to hurt yourself. So, but we give you all those post-op or post-care instructions. And really for me, after that local anesthetic wore off that night, I needed the ice pretty bad. And I took some ibuprofen, and but the next day when I woke up, there was no pain at all. I was just puffy. So I would say for women, if you wear the next day, don't wear like an underwire bra, because I did, and I made that mistake. So that's what happens when you're patient number 1. So, I would say something like a soft sports bra, or, something that's just going to be a lot softer for your clothing the next day. And because you're going to be a little puffy, it's, I had a lady who was thinking about having it done, but she was going to be going to Australia. This was like last fall. And we just thought, she better do it when she comes back, because, depending on how long she might be a little bit swollen, she wants to be in her bikini looking amazing. You might want to just give it a couple days. You don't want to have some big event the very next day.
And you
So,
see,
oh, hello. Let me hit stop share. Oh, there you are. Hello. Okay, she's back. So I kind of gave them, while you were out and coming back in, I gave them just from my perspective as a patient, kind of what I felt like that night and the next day. So let me see what other questions that came in.
You've had treatment done and you've had it firsthand. I feel like you can kind of help guide people. So I appreciate you being able to do that. I apologize. That was
hey, the technical, it's it's okay. So let's see. One person said, I don't sweat a lot, but I do prefer natural deodorants. So find myself sweating more when I wear certain fabrics. Is this treatment helpful even if you don't have excessive sweating?
Yes. So this treatment's great, even if somebody, like say you don't want to do as much dry cleaning. I know that might sound kind of silly at first, but if you think about it, like all the money that you're spending on your dry cleaning, all the money that you're spending on like your antiperspirants. I know there's a lot of media too about the aluminum that's found in the antiperspirants and it being possibly linked to breast cancer. So that's definitely a lot of concerns for a lot of patients that I've done consultations with. And when I see them back for follow-up, they're extremely excited about their results and the fact that they're not having to actually wear deodorant. And, just the added benefit of not having to do as much laundry or as much, like I said, dry cleaning as well too.
Yeah, I think that's, your clothes really, even without having hyperhidrosis, your clothes, especially like white clothes, you have to clean them more often. And yeah. So one other question we have from the audience is, do I need a consultation and could I get the treatment the same day?
Great question. Typically for this treatment, I do prefer to see my patients kind of for a consultation. If it allows us that day, like this treatment time frame is a little bit longer than most treatments, just because we do want you to kind of numb for about a half hour with topical anesthetic first. And then it takes a little bit of time to kind of, look at the underarm and kind of tailor the result to you. If you're interested, sometimes we might have like an opening that day where when we book you, you say you want to do treatment that same day. And our girls up front are amazing at kind of like, taking in good intake questions and asking them like, are they, a good candidate for the treatment itself. But typically with this treatment, I would say most of the time it would be something that we would do a consultation prior to, and then planning it for treatment a different day.
And also now that that's a really good segue, because we are doing virtual consultations. That might be something that, if you really were thinking, we could do a virtual consultation ahead of time, and then, then you could kind of get that out of the way. And then by the time we're open again, whenever that will be, hopefully soon, then hopefully, then they'd be ready to go. Would that work?
Yes, I think that would be a great alternative, because it's just really kind of like sitting down with a patient too, and just kind of like going over like their medical history together. There is just a few contraindications to this treatment itself. And that would be, if you are someone that has an implantable like defibrillator, or if you have a pacemaker, or, obviously be pregnant or breastfeeding. But also some patients have a little bit of an intolerance or an allergy to lidocaine. And this would be something that you would want to have the lidocaine on board to do the procedure. So those would be some things that we would kind of talk about, as well as kind of, just making sure that we're meeting together as a provider patient and kind of getting the end result that you're interested
in. Awesome. And so those are all the questions we had. And let me just ask you, since we're talking about hot topics in the med spa, what else, like, what are you really excited about, Kara, in terms of, things that you're doing in the med spa, treatments that you're really excited about the results that you're seeing?
Of course. Okay. So I have to be completely honest. During this quarantine, I have been finding it hard to exercise and to eat the right food. So I've been gaining weight. I'm not going to lie. I'm just going to put it out there. I am gaining weight. And I love the cool sculpting treatment that we have done several years now. And I've had cool sculpting treatments done myself in the past. I see great results with that. It's one of those things that we can kind of, going into the summer months and having this time where we aren't able to be as active as we were before. I definitely foresee that being like a really popular item coming back into the office. I'm even looking at myself in my sweats sometimes and thinking my sweatpants are tight. So if anyone's worried about, kind of like this time that we're going through right now, hang in there. As soon as we can see patients, our team is amazing and kind of going over and, evaluating it and seeing if you might be a good cool sculpt candidate. I also, I'm a big fan of like injectables, as well as kind of, oral therapy treatment. So we do have a lot of fun treatments at our office that we can definitely kind of go more in depth with, which I'm excited about.
Yeah, and we're going to keep doing these fun quarantine sessions. So we're getting our schedule together for next week. So we'll definitely do some deep dives into some of the other procedures and treatments that we have in the office. And so then I'm going to go ahead and share my screen again. Thank you, Kara. You're awesome, and I'm glad you were able to get back into the to the meeting. It was, every day is a new challenge, and we just roll with it. And I thank you guys, all of our audience, for rolling with it too. So like I mentioned, we do have virtual consultations, and that includes skincare, about any of the procedures we're doing, any of the surgical procedures downstairs in our surgery center, if any of you have been there. So you can call or text us at 858-452-2066, or you can email us, lookgreat@ljcsc.com. And you can also get text messages from us and be on our text list, kind of like your email list, but it's our text list. And we don't go crazy texting you all the time, but we do want to share, important updates, or let you know when we're doing these quarantine series. So just text GLAM to 858-452-2066. And with that, I'll just let you all know that tomorrow we have another one with Cameron, our esthetician, and we're doing that at 11 a.m. tomorrow, same time, same place, or not same time, 11 a.m. Tomorrow. And Cameron's going to be going over a really amazing procedure that we just started, and it's made by the makers by Skin Medica, and it's called Diamond Glow, and it's a new and facial treatment, but it's way more than a facial. So she's going to talk all about that, and she's going to take you on a tour of her medicine cabinet. And let me tell you, I saw a preview. It's amazing. So you don't want to miss that. That's tomorrow at 11. And so we have the link on our bio to sign up, and also on Facebook and in our e-blast, and then we'll also send out the link in the morning on our text to our text group. So text GLAM to 858-452-2066. And thanks everybody for joining us. It was super fun, and we'll have a replay of this in case you missed it, or somebody else missed it and you want to come back in, or if you had to leave early. So we'll be posting this, so stay tuned for that. But with that, thank you everybody, and we will see you on our next webinar. Bye-bye.